So I never miss an opportunity to talk about exercise because everybody needs to do more of it, and so any additional motivation that I can give you to do it, I'm going to do that. So research shows that inactivity is associated with the development of psychological disorders. Increased physical activity is associated with lower risk. Now, there's a circular thing to discuss here. Does being sedentary to contribute to depression, or does being depressed make you more sedentary? And I think a little bit of both are going on. But to break that cycle, you have to start exercising for a whole lot of reasons, not just this. So I'll show you some studies. Now, this one was interesting for a dose-dependent reason. So 561 volunteers at a university chose to exercise or not, and then how much exercise to engage in. And the active groups had lower depression scores, but what was interesting is that the more they exercised, the lower the depression scores got. So a dose-dependent effect is always something that we look at as a way to strengthen an association between two things. And what was interesting in this study, too, is there was a wide spectrum of types of people in this study. And so active, normal, and depressed students got better. So some people aren't depressed and they don't have anger issues and that sort of thing, but they can still get better. They can feel better if they exercise. 30 community-dwelling, moderately depressed adults randomly assigned to exercise, social support, or a wait list control. The exercise intervention, it was nothing huge. They were just walking 20 to 40 minutes 3 times a week for 6 weeks, and exercise was the most effective at relieving depression. Participants were randomized in another study to exercise on a cycle for 30 minutes 4 times a week, or a control group, and compared to the controls, those who did the exercise were significantly better off. And what was interesting is 3 months later, they were still better off. Now, that doesn't mean that you can exercise for a few weeks and stop, just to be clear about that, right? You have to keep doing it. And that's where the problem is, right? Keeping doing it. But if you can make it a habit, it helps with an awful lot of things. I'm going to make this go back. Just 30 minutes of treadmill walking for 10 days resulted in a statistically significant reduction in depression. And what's important about this is people who are depressed or anxious, they want to feel better not by Christmas. They want to feel better by the end of the month. And you can get some very quick results with exercise. In fact, the drugs are so ineffective, and I don't know if you've seen the ads on TV, like if your current antidepressant isn't working, add Abilify, right? So a lot of the drugs, even though the promise is that they can make you feel better instantaneously, it actually doesn't work out that way in practice all the time. So you're actually better off exercising your depression away and your anxiety than using the drugs. Depressed adults who engaged in 12 weeks of training versus controls, the training groups had larger drops in depression and anxiety than the controls, and a year later, that was maintained. And I'm sure some of it was because some of those people continued to exercise. And again, you can't like store exercise so that you don't have to do it. Resistance training reduces the symptoms of depression. A study comparing running and weightlifting versus control, both types of exercise were terrific. The controls got slightly worse, while those exercising got better. Running is as effective as psychotherapy in relieving depression. And we have a biological mechanism for that, which I'll share with you in just a minute here. 156 depressed adults randomly assigned to exercise, medication, or both for 16 weeks. The medication worked more quickly, but at 16 weeks there was no difference. And so researchers concluded that in the long term, exercise was as effective, and there are no negative side effects. 10 months of follow-up, the exercise group was still better off than the medication group or the combination groups. So what you could say is the drugs are so bad that it blunts the effect of the exercise. That's pretty bad, right? Better to work out. An analysis of 30 studies showed the most important factor in efficacy of exercise for depression was length of exercise. You had to do it for 9 weeks or longer to get an outcome. So sometimes people will ask me, because we own an athletic facility in our building and we have a hot yoga studio, and they'll say, okay, you've talked me into it, I'm going to start working out, am I going to like it? And I tell them, no, you're not going to like it. It's going to be awful in the beginning. It hurts and everything's uncomfortable. They'll say, well, I'm going to come to those hot yoga classes. Am I going to like it? I go, no, you're going to hate it. It's hot. You're going to sweat. You're going to have to sit down a lot. I mean, just be honest with people. But if you can get them past that initial period of time where everything's uncomfortable and the muscles hurt, it really starts to get easier and people look forward to it. And So you just have to stick with it. And it's equally effective for men and women, all ages, and for people who are severely depressed. So obviously the challenge, if you're severely depressed, is to get you to exercise. But once you cross that threshold, things start to get better. Exercise is proven effective also for anxiety and panic disorder. A study of 24 people with severe anxiety randomly assigned to aerobic exercise or no exercise control, and a lot less anxiety after exercise. And that's not surprising. I mean, I'm a runner, and I don't know about you guys, and how many people in the audience are runners? Like runners, okay. How many of you, if things are really stressful, like you've had just a god-awful day, or you find yourself with an hour in the middle of a god-awful day, find that if you just go out for a quick run, even if it's 2 miles, you feel better? Yeah. And I'll do that. You know, fortunately, I work for myself, and I have that kind of freedom, and I have all the stuff right in my building if I want to do it. But I found that the best thing to do to get my mood set for whatever I'm going to do in the evening, teaching or whatever, just go out for a quick run. Resets you right away, right? A review of 31 articles showed that regular aerobic exercise improved anxiety and panic disorder, and lots of studies showing that it reduces levels of neuroticism, anxiety, and depression. And I think the problem is it's just hard for people to believe that something so simple and free, good running shoes is all you need to get out the door and go for walks or runs, could actually be so effective. Now, this was very interesting. 128 men hospitalized with major depressive disorder, anxiety disorder, alcohol addiction, toxicomania, psychotic decompensation, and bipolar disorder. Those who participated in physical exercise showed significant improvement in mental health. Patients with major depression showed the most interest in exercise and spent more time at it, and the best results were from cycling and hard gym workouts. Now, if you can take a group of people who are in this psychological state, and they're willing to exercise, the ones in the worst shape were the ones who said, I'll do it, probably looking for relief in any way they could find it. And I mean, this is really, if you could put exercise in a pill, we'd all be billionaires if we owned an interest in the drug company that made it, right? Unfortunately, you can't do that. You actually have to do the exercise. Let's talk about exercise and addiction, which is closely related to mental health. Just 10 minutes of moderate intensity cycling reduced alcohol cravings in adults who had recently completed a treatment program. I subscribe to Runner's World, because I'm a runner, but I love the inspirational stories, a lot of which are about people who had addiction problems who helped to resolve their addiction problem from running. The review showed that exercise can be helpful at all stages of addiction, regardless of which substance the person has become habituated to. It can serve as an alternative to drugs and a means to prevent relapse. And I remember somebody saying one time, well, I think some of those people you're helping have just become addicted to exercise instead of drugs. And I'm saying that's a bad thing, right? Okay. If you're switching addictions to exercise instead of drugs, I'm all for that form of addiction. I think it's great. Okay, so what is the mechanism? Well, exercise helps repair some of the damage to the brain that can result from taking psychiatric drugs or abusing opiates or street drugs. Brain-derived neurotropic factor, BDNF, assists in brain cell communication and cognition and increases the production of GABA, a neurotransmitter that assists humans in achieving calmness and reduces anxiety. So exercise improves the production of BDNF, which improves your brain, your mood, your intellect even. That's why I'm so smart, actually. It's the production of BDNF. Just kidding. All right. Children with ADHD randomized to participate in a 10-week exercise program or control for 10 weeks. The kids in the exercise group did better. Is anybody surprised about this? I mean, our kids need to run around and play. And one of the things I'm completely opposed to is this structured preschool where we're sitting down and learning. At 3 years old, my sister and I were running around the backyard and getting dirty every day, not sitting in a class trying to learn something. So I think part of the problem is kids don't get enough exercise, and we need to promote more of it at an earlier age. A meta-analysis of studies looking at exercise and ADHD. Aerobic exercise was particularly helpful and resulted in improvements in executive function, attention, behavior, cognitive, and socio-emotional factors. A review of exercise and ADHD showed symptoms of ADHD improved with all types of exercise interventions, and it affected social behavior, motor skills, strength, and neuropsychological measures. And no negative side effects are reported. You take a look at these drugs, the side effects are heinous. Eating plants and exercise, there are no negative side effects other than the adjustment period to get used to it. And I do own a yoga studio, full disclosure here. Yoga is great for mental health. I can testify to it. One of the reasons I am not in the asylum is a yoga studio is in my building, and I go several times a week to yoga in addition to teaching yoga. And you'd be surprised how many of our students say that, even to the point that sometimes it'll be a crazy day in our office, and I'll say, I don't know if I should go to yoga or not. Everything's so busy. And you know what my staff says? No, you should go to yoga. Actually, you go, we're fine. And the reason why they say that is because they know that life for the next 12 hours will be a whole lot better if I go to yoga first. So, some studies show that yoga is as good as antidepressants and in fact has the same effect on the brain as antidepressants. It increases serotonin levels, lowers inflammation, reduces oxidative stress, clears your mind, can't say enough good things about it.